Thank you all for joining us. We just completed a short tour of a number of the labs upstairs. I think a very exciting time. I'd like to thank you for joining us for this important announcement. For those of you who don't know me, and in fact, even though for those of you who do know me, my name is Art Slutsky. I'm Vice President of Research at St. Michael's Hospital. It's my honor to host this announcement today. I'm especially proud that of the 7 SPORE grants that were awarded across Canada, 3 of them are coming to St. Michael's Hospital. SPORE stands for the Strategy for Patient-Oriented Research. The research that's going to be performed by these 7 teams are funded by SPORE, are innovative clinical trials. Clinical trials provide rigorous assessment of various interventions and puts patients at the center. The results of the studies will give clinicians the evidence they need to provide optimal care and hence lead to enhanced quality of life for all our patients. At St. Michael's Hospital, we strive to do research that is meaningful, creative, and impactful. And I think that the 3 studies out of St. Michael's Hospital that are being funded by this program do this. We have one team striving to reduce the complication of diabetes. We just heard about those a few minutes ago, talking about the basic science underlying a lot of these clinical trials and also the clinical trials. Another group is examining the impact of different types of milk on childhood obesity, also an important problem that actually has links to diabetes as well. And finally, another one is introducing a new model of clinical trials for critical care across Canada. And that's important because the patients who come to the critical care unit are the sickest of the sick. Many of the patients on the weekend, unfortunately, ended up in the intensive care unit. So doing clinical trials in the ICU is very important. These projects have the potential to improve the health of thousands and thousands of patients. This impact is what drives scientists to dedicate their lives to research, and is what drives them to innovate on a daily basis. Today you will hear from a Member of Parliament, a representative from the Canadian Institute of Health Research, the CHR, one of the principal investigators who was awarded a grant, and a patient who is impacted by our work. It seems that this event is as multidisciplinary as the teams that are being funded. Now I'm delighted to introduce Member of Parliament for Brampton South, Sonia Sidhu, who will tell us more about the projects awarded and the impact they will have. Please join me in welcoming Member of Parliament Sonia Sidhu. Thanks very much.
Thank you, Dr. Slutsky, for your introduction. Good morning, everyone, and thank you to everyone, St. Michael's Hospital, for welcoming us here today, and for everything you do for community, as witnessed once again this past weekend, and your response for terrible tragedy that happens on the weekend. Thank you once again, and your whole team. This outstanding hospital has a long history of caring for the sick and poor of Toronto's inner city. Of course, St. Michael's also enjoys a long history of research excellence, which is what brings us here today. The Government of Canada understands that health research is one of the most important investments we can make as a nation, and that is why Budget 2018 proposed the largest increase in new funding for fundamental research through the granting councils in Canadian history. We know that investing in health research today leads to long-term cost saving and reduced wait times for healthcare. Most importantly, investing in health research saves lives. That is why I'm so pleased to announce today that the Government of Canada, through the Canadian Institutes of Health Research, is investing $9.3 million to support 7 new projects under the Innovative Clinical Trial Initiative. In addition to $9.3 million provided by CIHR, these projects are also being supported by an investment of $13.3 million from our partner organizations. I would like to sincerely thank our many partners for their generous contribution to these clinical trials. To date, CIHR has invested a total of $16.8 million in this initiative, which is supported by the Strategy for Patient-Oriented Research, SPOR support, partners between the federal government, provincial government, researchers, charitable organization, and many others. And because these projects are funded through SPOR, each of them will involve patients in their design and delivery. This patient's engagement is vital as it allows the voices and perspectives of those who receive the care to inform the structure, aims, and conduct of the research. 3 of the research teams that are being supported and located right here at St. Michael's Hospital. On a personal note, I'm very excited to see that one of these projects is focused on diabetes, a health condition that is very important to me. As you may know, about a quarter of people with diabetes develop painful foot ulcers. If these ulcers are not managed properly, they can lead to amputation. As you know, in Ontario, amputation rate is very high. One of the most feared complications of diabetes. Dr. Subodh Verma and St. Michael's Hospital is investigating whether chiropodists are the answer that has designed a novel trial that will follow 2,200 participants from 40 cities in Ontario, Alberta, and Manitoba. His study will seek to determine if chiropodist care can lower amputation-related hospitalization for individuals with diabetes. Undergoing dialysis, since the group is deemed to have the greatest need the treatment. In addition to diabetes, the funding we are providing today will also support efforts to reduce the number of unnecessary tests and treatment administered to patients, support primary care providers to improve how they prescribe opioids and antibiotics, tackle childhood obesity by examining children's milk intake, improve care and outcomes for patients admitted to ICU, help patients with multiple complex health conditions navigate the healthcare system, and help young people who experience mental health conditions such as schizophrenia. Through these innovative clinical trials, we'll seek the test drive novel research, designs, and techniques that will hopefully provide an alternative to traditional randomized controlled trials, which can often be time-consuming and expensive. Ultimately, it is our hope that this investment will result in new treatments, medicines, and therapies that can be used to improve the health of Canadians and strengthen our healthcare system. On behalf of the Government of Canada, I know this is our Finance Minister, Bill Morneau's writing. He's doing tremendous work. He's a hardworking person you elect as a member of Parliament from this riding. I would like to express my sincere appreciation to all the patients and researchers who are involved in these efforts. We are proud to support your work and wish you success in your important endeavors. Thank you very much once again.
Good morning. I'm Dave Clements, and I'm very pleased to be able to represent the Canadian Institutes of Health Research as well as the Strategy for Patient-Oriented Research today. First of all, my congratulations and thanks to St. Michael's for hosting this event and for having 3 teams funded through this latest round of SPOR funding of 7 total teams. We congratulate the other 4 as well. A number of individuals from the Strategy for Patient-Oriented Research funded initiatives are here today. I would like to thank them and congratulate them for their ongoing work. CIHR, on behalf of the Government of Canada, is honored to be able to partner with you. SPOR, the Strategy for Patient-Oriented Research, is a true partnership with healthcare organizations, researchers, healthcare charities, and others. But most importantly, it's the partnership with patients that is the guiding principle here. It's really at the heart of SPOR. And that's exemplified by all of the 7 projects that are being announced today. In all of these initiatives, patients have been involved in guiding the design, and will be critically involved in the execution and implementation. Our philosophy is that patients hold a lot of wisdom about the conditions that they are facing, and we need to honor their values and their perspectives. The issues being tackled by these teams are also the critical priorities of Canadians. Things like childhood obesity, early psychosis, or unnecessary healthcare that can often be harmful to patients. Critically, they are also issues that are difficult to address through traditional randomized controlled trials, which are known to be the gold standard of evidence. And while they remain the gold standard of evidence, clinical trials can be challenging to conduct, and they may not be the most appropriate method to address some of these critical emerging issues. They are large and costly and time-consuming. They may not address multifaceted interventions as well as other approaches. And finally, it can be very challenging to address real-world implementation challenges through traditional RCTs, which are so critical to improving the healthcare experience of Canadians. Canada is truly at the cutting edge of a global movement here, and that's exemplified by the teams funded here at St. Michael's and across Canada. The teams that are being funded here will contribute to the improvement of the health of Canadians, and on behalf of CIHR, I'd like to congratulate all of you. And it's my pleasure to turn the floor over to Dr. Subodh Verma, who is a scientist here in the Cardiovascular Disease and Diabetes Research Program at St. Mike's.
Great, thank you, David. Thank you to both of you. We're absolutely thrilled and delighted that we can host this event and that you've taken time out of your schedules to come and celebrate the successes here with us. For those of you who don't know me, I'm Subodh Verma. I'm one of the heart surgeons here at St. Mike's. I'm also a scientist, and I have the great good fortune of leading this team of the SPORE grant that was funded looking at novel ways of preventing amputations in people who are at risk in dialysis units with diabetes. So what I would like to do is really on behalf of our team represented here today, and maybe they could come up as I call their name, Dr. Mazur, Dr. Al Omran, Adrian Kwan, Hui Teo, Dr. Peter Juni, Larry Leader is out of town, Dr. Chris Chan, who's I don't think here today, but from the University of Toronto at Toronto General, Dr. Dalla, Judy Hall, Mariam Botros, Bruno DaCasta, Dr. Mohammed Hussein, Juana Rude, Marnie Wilson, Anne-Marie McLaren, Dr. Yanagawa, who's I think back in the operating room, Dr. Gary Lewis, and Dr. Catherine Whiteside. If you could all join us here. This is really what the team, this is part of the team, guys, who's going to be really helping us with this very important question. And let me first and foremost tell you that on behalf of the entire steering committee, we earnestly thank you, and we're very grateful for what you've done, not only for patients, but for also this team. As you've mentioned in your opening remarks, diabetes remains a real titanic struggle. There's 425 million people globally who have diabetes. That number will go and grow to 650 million over the next few years. And at the end of the day, when the rubber hits the road, it really is about complications in diabetes. It's not that that just consumes healthcare dollars. That's, of course, quite measurable, but it consumes quality of life. And it not only leads to early mortality, but it extracts a number of good years from people in their prime. And preventing complications requires no explanation. It is the most important reason for treating diabetes, is to prevent people from dying early, to extend their life, and as Dr. Mazur mentioned, to make lives more livable. The most feared complication in the minds of people with diabetes is losing a limb, followed by losing your eyesight, followed by kidney disease. So sometimes things that researchers spend a lot of time thinking about, such as heart failure and other things, in the minds of patients actually carry very little gravitas. What matters to them is, exactly as David mentioned, sometimes we don't ask those questions. What do you fear the most? And can we find solutions to those problems? And diabetes-related amputation prevention was really a topic as this team embraced it and met with patients and interviewed patients. The stories that they shared with us about, loss of, social functioning, depression, caretaker fatigue. Somebody mentioned that, diabetes, loss of a limb was worse than dying. I don't think I need to stand here and justify why preventing limb loss is important in diabetes. It is something that we need to do. Professor Al Omran here, along with Catherine Whiteside and Dr. Lewis, is leading an initiative under Diabetes Action Canada, trying to find durable solutions for prevention of amputation. And it is quite striking that amputation rates in Ontario, as you mentioned, Sonia, if anything, we would hope they're going down. They're going in the wrong direction, and that data will be published soon. So despite the fact that standards of care are better, and there's better hospitals and better doctors and better background therapies, amputations remain a recalcitrant and grievous problem in diabetes, and we need to do better. People can't show up with diabetes and lose their limb anymore. So oftentimes in medicine, we spend our dollars, and as doctors, we treat the disease after it has manifested. Sometimes it's too late, and all we are left with is the option to, limb loss or amputation. And many of these things can be prevented early. And as they say, it's better to show up 3 hours early than 1 minute late. And that's what we need to do in diabetes. And that's what this entire team is focusing on, is can we find the people that are most vulnerable? And some of the outstanding work that Professor Chris Chan has done as the university director in nephrology has sort of led to the idea that maybe surveillance with the key experts who know about the feet, chiropodist or chiropodist, in fact, we're still debating what is the right way to pronounce it, maybe they're the ones who need to be put into situations where they can see a problem before the problem is too late to be recognized. And it was an idea that he came up with in a smaller study that now we're trying to take to a much bigger scale to say, can a simple intervention such as multifactorial chiropodist-driven care identify problems? Can they be treated early? Can surveillance be taken to the next step? And can we prevent amputations and hospitalizations from this problem? I think as David mentioned, and I think Sonia, you mentioned as well, at the end of the day, what really matters is what matters to patients. That's why we're here as doctors and scientists, is to find cures for diseases, but they have to be palpable and measurable and impactful to the end user. And that end user is the patient. And, we're just so fortunate to be one of the 3 teams at St. Mike's and one of the 7 that really feel that we are hopefully going to test an important question that can have measurable, important impact for patients, but maybe also prevent, thousands and even more amputations worldwide through simple, non-pharmacological strategies of surveillance and aggressive sort of treatment. Really with that, I'd like to invite one of our patients, Ross Marin, who has diabetes, and he's going to come and speak to you a little bit about his journey. Thank you very much, Ross. I know you've got a flight to catch, and you've given us a few minutes. We really very much appreciate it. We'll stay with you here,
What
Ross.
an impressive group. Thank you much. Thank you very much, Dr. Verma, for that warm welcome, and thank you to all of you for having me here today. I'm very honored and humbled to be in front of a group, like fantastic group of guys here doing tremendous work. My name is Ross Marin, and I'm one of the 3.1 million Canadians living with diabetes. Within the next 2 years, that number is expected to rise to 4.2 million. I was first diagnosed with diabetes last September, and that was when I first found out how serious the illness is. It wasn't until today's tour that I've elevated that notch quite a few levels higher. When people hear cancer or the C word, they're horrified. But when people hear of diabetes or the D word, you really don't get a reaction from them. There are many serious complications that come from diabetes: kidney challenges, heart challenges, losing your eyesight, as mentioned before, losing a limb. One of the complications that I fear the most is losing a limb. In Ontario alone, there's an amputation every 4 hours due to a diabetic foot ulcer. So it's terrifying. It's a terrifying potential reality for me and for all those living with diabetes that this can actually happen. Last year, due to several health challenges, I was told I couldn't drive. And the very fact of that, I saw the stress that it put on my family and those around me. And when you lose the functionality of a part of your body, it's hard to go on, and it's then you really understand how serious that it was. I can imagine losing a limb. Everything around me would change. I'd have to learn how to walk again, get around. But the huge impact that it would have on my family, my friends, my coworkers, etc. I'm incredibly lucky to have Dr. Verma as I'm a patient to him versus him as my doctor. He and his team earlier this year had operated on me as I had heart issues. And now I get to watch as he works to reduce the burden of the complication I fear the most. The fact that people, after today's tour, the fact that people are actually studying diabetes and its complications makes me very happy. The fact that the federal government is supporting it, I'm grateful for that as well. On behalf of all the patients, when I say thank you, on behalf of all the patients, it's not just for what you've done to date, but as researchers, thank you for everything that you do, and that we truly appreciate that. And thank you for including us patients as your partners in solving this. We are working together. Sorry.
You're doing a great job, by the way.
There's a lot of people here medically, and I'm thinking, all of us working together is going to ensure that the future of healthcare is innovative, it's patient-friendly, and it's impactful. And one of the things that I enjoy seeing is that it's giving the patients it's giving the right patients the right intervention at the right time. Thank you very much.
Fantastic.
Thank you. Mr. Mayor, and thank you very much. That's what drives us. You know, that kind of speech, which clearly was from your heart, is what inspires scientists, clinicians here to work hard every day. And we have learned tremendous amount of things from patients. So thank you very, very much. And thank you again for the Government of Canada for the support. It's critical. Thank you to CHR. And I'd like to thank all the scientists. You see only a small smattering of the scientists who are around. They are working, as I said, every day. And the focus here is to have impact on patients. So, Mr. Marin, you know, hopefully you'll come back in a few years and we'll see that we've had an impact, that we've decreased the number of amputations in Ontario and worldwide. So that ends this official ceremony. There will be a time for a photo shoot, and if there's any press here who would like to interview either scientist, patient if that's possible, you know, if you can stay around, or the Member of Parliament or the CHR, we'd be happy to do that. So thanks again.